Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Warfarin. Review for current users. Introduction. Blood clots can happen in patients who have problems with their blood vessels, or heart. Blood clots may be dangerous. They may lead to the loss of a limb, strokes, or death. Your healthcare provider may ask you to take a blood thinner to help prevent harmful blood clots. Warfarin is a blood-thinning medicine. In spite of taking the prescribed amount of warfarin, factors such as illness, diet, exercise, and other medicines may affect how thin the blood is. If your blood is not thin enough, blood clots inside the blood vessels and heart may form. If your blood is too thin, you may be at a higher risk of bleeding. Controlling your INR. Your healthcare provider will take a small amount of blood to check whether the dose is correct. This is called an INR-test. You may also hear this test called a prothrombin-time-test, PT-test, PT-INR-test, or prothrombin-time-test. INR is the number that tells your healthcare provider how thin or thick your blood is. The prescribed amount of warfarin should help keep your INR within the acceptable limits, but things like illness, diet, exercise, and other medicines may affect how thin your blood is. This is why your healthcare provider will ask you to have your INR checked regularly. There are several things you can do to prevent sudden changes in your INR and keep your blood as thin as it should be. To keep your blood as thin as it should be, you should take the dose of warfarin prescribed by your healthcare provider at the same time each day. Keep your eating habits consistent. Keep your exercise level consistent. Have your INR checked regularly. Check with your pharmacist and primary healthcare provider before taking any new medicines, especially over-the-counter medicines, antibiotics, vitamins, and herbal products. Talk with your healthcare provider about products with aspirin. Do not take aspirin-like products such as ibuprofen, Advil, and naproxen, Aleve. For over-the-counter pain relief, talk with your healthcare provider about using acetaminophen. Tell your healthcare provider about any new or unusual symptoms. You should follow your healthcare provider's instructions when taking warfarin. If you miss a dose of warfarin, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. Keeping regular daily activities the same, such as consistent eating and exercise habits, will make it less likely that your healthcare provider will need to change your dose of warfarin. Because patients on warfarin are more likely to have internal bleeding with injuries, you should not play contact sports such as boxing, football, hockey, soccer, wrestling. Check with your healthcare provider before you start a new exercise program or sport. Because having too much food with vitamin K in your system may lower your INR, it is important to keep the amount of vitamin K in your diet steady. Foods high in vitamin K are beef or pork liver, broccoli, kale, spinach, Brussels sprouts, asparagus, collard and turnip greens. If you have any questions about other foods, check the warfarin manual or call your primary healthcare provider or pharmacist. The amount of green and leafy vegetables you eat should not change. You should eat small amounts consistently. If you choose to drink V8 products, you should drink them on a regular basis. Grapefruit and cranberry juice should be limited to 8 ounces or less a day. Ask your healthcare provider if you can drink any alcohol while taking warfarin. The more similar your activities and exercising habits are each day, the less likely it is that your healthcare provider will change the amount of warfarin you take. It is important to have your INR checked regularly. Your healthcare provider will tell you how often you should have this blood test done. Some people can check their INR at home. Once your healthcare provider gets your test results from the lab, he or she will tell you whether you should increase or decrease the amount of warfarin you take, and by how much. Make sure to tell your healthcare providers, even your dentist, that you are on warfarin. Taking warfarin during pregnancy raises the risk of birth defects in the fetus. It can also cause excessive bleeding during delivery. If you are thinking about becoming pregnant, are pregnant, or want to breastfeed, talk to your healthcare provider about warfarin therapy. Be careful when using knives. Razors and hard toothbrushes can cause bleeding. Use an electric shaver and a soft toothbrush instead. Patients who are on warfarin should wear a medical alert charm. This is very important in cases of medical emergencies when you are not able to communicate with your healthcare providers. When to call your healthcare provider? Certain side effects of warfarin are normal, such as chills or feeling cold, feeling more tired, bruising more. If these side effects become severe or do not go away, call your healthcare provider. Even if you are taking the prescribed amount of warfarin, dangerous internal bleeding or blood clots can still happen. It is important to tell your healthcare provider about any signs of internal bleeding or blood clots. This section will teach you about when you should call your healthcare provider. You or one of your family members or friends should call your healthcare provider if you have a serious fall or hit your head. This is very important if you start to have a headache or if you become sleepy or weak. If you notice any blood in your urine, pee, or stools, bowel movement, or if your urine or stools turn very dark, call your healthcare provider. The healthcare provider may want to check that you do not have internal bleeding in your digestive or urinary systems. If you notice unusual bruising, large areas of bruising, or black and blue marks on your skin for unknown reasons, tell your healthcare provider. This may mean that you are bleeding under the skin. Small bruises that result from minor accidents such as a leg hitting furniture are normal, and you do not need to call your healthcare provider. Check with your healthcare provider if you experience dizziness, trouble breathing, chest pain, or if you feel weak or more tired than usual. These can be signs of blood loss and anemia. Call your healthcare provider when there is bleeding that does not stop from a cut or from your nose. Call your healthcare provider if the bleeding does not stop after about 7 minutes. Call your healthcare provider right away if you experience a rash, hoarseness, hives, itching, swallowing problems. Call your healthcare provider right away if you experience flu-like symptoms such as diarrhea, loose stools, nausea, feeling like you need to throw up, vomiting, throwing up. Call your healthcare provider right away if you have an infection, loss of appetite, pain in the upper right side of the stomach, yellowish eyes or skin. Call your healthcare provider if your hands, feet, ankles, or lower legs are swollen. Tell your healthcare provider if you notice more bleeding than usual when you get your menstrual period, or if you have bleeding between periods. If you have a high fever or an illness that seems to be getting worse, call your healthcare provider. You should also call your healthcare provider if you notice any blood when you cough or vomit, or if you have loose or runny stools, diarrhea, or an infection with high fevers and chills. If you experience pain or swelling in any of your joints, check with your healthcare provider. This may be a sign that you have bleeding inside of the joint.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Healthcare providers prescribe a blood thinner to help prevent harmful blood clots. Warfarin is a blood-thinning medicine. If your blood is not thin enough, blood clots inside the blood vessels and heart may form. If your blood is too thin, you risk a longer bleeding time. The prescribed amount of warfarin should help keep your INR within the acceptable limits, but other things like illness, diet, exercise, and other medicines may affect how thin your blood is. For this reason, your healthcare provider will have your INR checked regularly. To keep your blood as thin as it should be, you should take the prescribed amount of warfarin at the same time each day. Keep your eating and exercise habits regular. Have your INR checked regularly. If you miss a dose of warfarin, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. Certain side effects of warfarin are normal, including bruising more easily. Small bruises that result from minor accidents, such as a leg hitting furniture, are normal, and you do not need to call your healthcare provider. If you see signs of internal bleeding, such as dark urine or stools, call your healthcare provider right away. Thank you for using Explain.